OK, we're now joined by James Elder. He's the global spokesperson for UNICEF, the United Nations Children's Fund. He joins us live from Al-Aqsa Hospital in Deir al-Balah. Thank you so much for your time today. Now, I know you're here on the programme to talk about the humanitarian situation in Gaza, but I have to ask you, James, about your reaction to what has happened in Lebanon overnight. How devastating are these recent attacks in Beirut going to be on a country that is already on the brink of crisis and catastrophe?
Well, Malin, exactly. I mean, no one needs what is going on right now, but of course the people of Lebanon, they've already dealt with the financial crisis. They dealt with the massive explosion of a few years ago. They have seen poverty rates skyrocketing. Yeah, the people of Lebanon have made it very, very clear that they simply need peace, like all the people across this region, to be perfectly honest. So in those early days this week when we saw at least 50 children killed, I think the great fear is that we're seeing an escalation, and everybody knows it's impossible to disentangle these two crises. It's also impossible to disentangle the thinking behind those people who are waging these wars, but surely, you know, any ceasefire, any significant humanitarian pause here in Gaza for these very long-suffering people of Gaza is going to help de-escalate that situation, and that's essential right now. I think it should have been clear for people for a long, long time. Certainly it's been clear for humanitarians. Certainly it's clear to Palestinians that there is no military solution to this. There never has been. You know, peace in the Middle East for the children here in Gaza, for Lebanon, for Israel, is not going to be brought about by the bombing of Beirut, is not going to be brought about by the killing of so many children or the devastation of hospitals. It's going to be a political solution, and that's the sooner we move to that, the sooner we end some of this horrendous suffering on mums, on dads and on children.
James, and you've seen firsthand, haven't you, the impact wars like this can have on children. In Lebanon, schools have already been closed for a week now and turned into shelters. This is how things started in Gaza. How bad is the situation now in Gaza for children a year into this crisis?
It's a very fair question. Of course, every time I come back, this is the fourth time I've been back, it gets worse. It has to get worse. It's a cumulative effect because there is simply no let-up in the bombardments. I mean, Al Jazeera is unique and it continues to show the story of Gazans, but it is fading from a lot of other media outlets. The bombs have not faded. Okay, so every time that I return, there has been continual denials and restrictions on aid. Most simple things, soap. All right, soap. Everyone knows here they need soap to prevent the spread of disease. Soap is up 1,000%. August was a month where the humanitarian agencies were able to get the least amount of humanitarian supplies for a population who has never, ever needed more. So when you look at these basic elements, these are the denials and restrictions that continue to go on. 85%, Malin, 85% of the Gaza Strip is under some form of an evacuation order. So already this place that was so desperately crammed, so desperately densely populated, which is one of the reasons these indiscriminate attacks have killed so many children, you know, crowding now an entire population to 15% of the Gaza Strip that's not under an evacuation order. That's why the spread of disease we warned of happened. That's why we had a polio outbreak. Yes, an organisation like UNICEF, we were very proud to bring in more than 1 million vaccines. Those humanitarian pauses for those few hours showed what can be done when these parties sit down and the population is allowed to breathe. But a polio vaccination is not a success. It happens because of the devastation of primary health care. And that is what we're seeing. And if I may, I think one thing that a lot of audiences don't always understand is there is one simple reason why Gaza has not collapsed, and that's because of Gazans. The literacy rate of Gaza, of Palestinians here, is one of the highest on the planet. It always has been. No matter how many crises here, parents and grandparents put an immense focus on education, on keeping their children educated. It's why graduates from Gaza are some of the most sought after. It's why when UNICEF works with nutritionists, with doctors, with health workers, with engineers to rebuild Gaza, we're working with Palestinians, we're working with Gazans. We are terrified right now, given this relentless bombardment, and because it has not eased up right now. If we lose a generation of these children, if you get to a point where mums and dads and grandparents, no matter how great their efforts, no matter how great an importance they put on education, the power is taken from them, then you threaten the entire region. And this is one of the many reasons why humanitarian pauses, ceasefires, call it what you will, something to end this suffering and allow Palestinians to rebuild, which we know they will, if given a chance.
And James, I have to ask you also about the situation at the medical facilities, the hospitals. You're standing outside Al-Aqsa Hospital. We've seen over the course of the last year, the Israeli bombs target many of the medical facilities. Since you've been back, you say you've been to Gaza 4 times. How are the medical facilities coping with not just the bombs and but also the various diseases that have come as a result of people living in poor sanitation, the malnutrition that people have had to deal with, and of course that polio campaign you were talking about?
Yeah, I somehow don't know how they cope. And again, they cope because of the relentless resilience of health staff who I spoke to a doctor yesterday. I ran into a doctor in a camp yesterday from Jabalia. He's 62. He's been a medical practitioner for 35 years after his home was destroyed. Now, he has nothing. He was showing me, the man's worked for 35 years as a doctor. He has no shoes. Now, doctors here at this hospital behind me, they start every day living in a tent because their homes have been destroyed, the homes that they built over decades and decades, like any citizen anywhere around the world, and they come to work. So the place is held together by these people. But, as they will tell me, as a parent will tell me, sitting with a child with an amputation or with horrendous burns, Melinda, I didn't know there was such a thing as 4th-degree burns. I've seen children sitting here, a little boy Hamid just earlier, who has no skin left to skin graft, so severe are his burns. Now, the medical system here does not have the antiseptics they need. They don't have the antibiotics they need. As a doctor said, patients just need their bodies to work through the infection. That is not a reasonable thing to request, and those are denials of medicines, of obstetric equipment, of all the basics that simply don't need to happen. There doesn't need to be these denials and these restrictions. And they've gone on and on and on. And there's had so many debates about what is allowed in for hospitals, what is allowed in for healthcare workers. And I can tell you, having spent a year of my professional life working on this is because restrictions. This is because we're given one entry point. We're given one road. There's a lack of security on the ground. There is a responsibility here, a very clear responsibility for the occupying power, for Israel, to facilitate those things. But as long as we see those denials, and the denials go both ways. There are children here, just like Hamid, who need to leave Gaza, who need to get medical care and psychological care, and they're not being able to get out. So there are so many things here that with a different level of intent, a different level of approach, could be fixed.
James, I really appreciate your time and speaking to us here on Al Jazeera. James Elder, the global spokesperson for UNICEF, the United Nations Children's Fund.